Hello, my name is Akira Nishizono from the Oita University Faculty of Medicine. I'm also a member of the APU's Student Health Management Support Network. With the novel coronavirus pandemic that has swept the world, I'm sure many aspects of your lives have been significantly impacted. Your classes are now online, you can't work as much, and you can't meet up with your friends. Many people are probably wondering how long this situation will continue. However, for the time being, we must prevent the spread of infection to avoid a collapse of the healthcare system. Today, I would like to talk about what you can do to protect yourself against the novel coronavirus. The novel coronavirus is abbreviated as COVID-19. This is a respiratory disease caused by a coronavirus that spreads from person to person through droplets and contact. First, let's define some terms. COVID-19 refers to the respiratory disease caused by the novel coronavirus, SARS coronavirus 2. Until this disease was discovered, there were 4 known types of coronaviruses, known as common cold viruses, which can be caught multiple times. On the other hand, the SARS coronavirus, the MERS coronavirus, and the novel coronavirus can all develop into severe cases. Looking at the symptoms of COVID-19, first you will notice cold-like symptoms, like a fever, runny nose, and cough. Another typical symptom is that you may find it difficult to recognize smells and tastes. In many patients, that is, around 80%, symptoms are mild, but about 20% of patients experience respiratory difficulties or develop pneumonia, and in some severe cases, they require treatment with a respirator or ECMO. Some of these patients with severe symptoms end up dying. X-rays and CT scans of the chest show typical viral pneumonia images like this one, with ground glass-like areas scattered throughout the lower lungs. The figure on this slide compares the infectivity and disease intensity, that is, lethality, of COVID-19 with other typical viral infections. Measles is a highly infectious viral disease that is shown on the right inside the red circle, but the lethality is 1 or less, so it has been plotted on the lower right of the figure. Meanwhile, the Ebola virus, avian influenza, SARS, and MERS are inside the blue circle in the upper left because they are highly lethal, but not that infectious. From what we know at this point, COVID-19 appears to be slightly more lethal and infectious than influenza, so we think it would probably fall within the pink, or is that dark pink, zone in the bottom left of the figure. So what exactly is an infection? Infections come about when there is an imbalance in power between a microbe and a host. No matter how strong the host may be, if the microbe is even the slightest bit stronger, the imbalance will lead to an infection. On the other hand, even if a microbe is not that strong, if the host is weak, that is, lacks resistance or immunity, the imbalance will lead to an infection. In other words, the key is keeping disease-causing agents in balance with your body's resistance to those agents. With this in mind, what does the power of the host mean? COVID-19 may not be a very frightening disease for young people like you in your teens and 20s, but as this graph shows, severity and death rates increase the older you are. In addition to old age, other causes for severe cases include heart disease, diabetes, respiratory disease, obesity, and cancer. In short, COVID-19 is much more frightening for older patients who have underlying conditions. On the other hand, what does the power of the microbe mean? There are 2 kinds of viruses, those that are covered by a membrane of fat and those with a protein shell. Viruses with a fat membrane, as shown on the left, include influenza viruses, coronaviruses, and HIV. These are relatively weak viruses whose outer membranes can be dissolved with soap or alcohol disinfectant. Meanwhile, viruses like the norovirus, which can cause diarrhea in the winter, do not have a protective fat layer, so they are relatively resistant to disinfectants. This means the most effective way to prevent the spread of COVID-19 is to wash your hands with soap or another disinfectant. Because it spreads from person to person, the most important thing to remember about COVID-19 is the route of infection. The three routes of infection for COVID-19 are as follows. The first is droplet or aerosol transmission. Aerosols refer to the fine particles that are suspended in the air. Aerosols are gases and the solid or liquid particles suspended in those gases. And the term refers to particles suspended in the air such as dust, smoke, mist, and air pollutants. The next route of infection is contact transmission. And the third is aerial transmission, or inhaling aerosols in closed spaces. First, let's distinguish aerosol transmission from aerial transmission. Aerosol transmission. Most of the droplets emitted from the human mouth through coughs and/or sneezes have a diameter of 5 micrometers or more. A micrometer is 1/100,000th of a meter, and immediately fall to the ground within a range of 1 to 2 meters. You will not get infected unless you are directly coughed or sneezed on. Meanwhile, droplets measuring under 5 micrometers are affected by the humidity in the air, and after being discharged, they float in the air for a while. Inhalation of these droplets causes infection. Most COVID-19 infections are caused by people inhaling tiny aerosol particles measuring under 5 micrometers. Aerial transmission, on the other hand, refers to an infection caused by inhaling what is floating in the air after the moisture in the aerosol has been completely lost. Here is a slide showing what I just explained. Most of the droplets emitted from the human mouth through coughs and/or sneezes have a diameter of 5 micrometers or more and immediately fall to the ground within a range of 1 to 2 meters. Meanwhile, droplets measuring under 5 micrometers are affected by the humidity in the air, and after being discharged, they float in the air for a while. Inhalation of these droplets causes infection. This is called droplet or aerosol transmission, and it is the primary vector for influenza, mycoplasma, diphtheria, and coronavirus infections. Because aerosols float in the air, there is a higher risk of inhaling them in poorly ventilated closed spaces. Aerial transmission refers to an infection caused by inhaling what is floating in the air after the moisture in the aerosol has been completely lost. This is how tuberculosis, measles, and chickenpox are spread. So, what do you need to keep in mind to prevent aerosol transmission? First, you must be careful when meeting people face to face without a mask, especially when eating together. Everyone has to take their mask off to eat. If you talk in close quarters while eating, it is easy to see how you discharge aerosols from your mouth. This means that the primary benefit of wearing a mask is to ensure that you do not infect others if you happen to have become infected, rather than protecting yourself from the virus. That being said, masks do help protect you from catching viruses from other people. Universal masking refers to the practice of wearing a mask at all times to protect others from infection, because we do not know who is infected. The basic way to prevent the spread of COVID-19 is to prevent aerosol and contact infections. So the primary tool for this is a normal surgical mask. However, doctors and nurses who are treating people with coughs and sneezes must use high-performance N95 masks. It is important for healthcare professionals to use N95 masks when treating patients in hospitals, especially in closed spaces where infections are likely to occur. Next, let me explain contact transmission. Objects, places, and equipment that many people might touch on a regular basis may have been coughed or sneezed on by people infected with COVID-19. Studies have shown that, under certain conditions, the virus can remain on some surfaces for 1 or 2 days while maintaining its infectivity. Therefore, you must exercise caution because touching your eyes or nose with a hand that has touched such a place or thing creates a major risk of infection. This is why it is important to wash your hands thoroughly. To prevent infection caused by the inhalation of aerosols in a closed space, it is important to open a window and create a flow of air by using a fan blowing from the opposite direction. In a room without windows, it is also important to use a fan to direct the flow of air toward the door. You also need to be careful of things such as loud conversations and aerobic exercise in poorly ventilated rooms. On the other hand, there is basically no need to wear a mask when jogging or walking outside if there is a sufficient breeze. We often hear the term close contact, but what exactly does this mean? The definition for this term is shown below. Spending a long time with others within a distance of 1 meter in the same room or house. Spending 15 minutes or more with someone while eating or otherwise not wearing a mask. And touching a surface that has come in contact with the virus without wearing a mask or gloves. This poster issued by the CDC shows the preventative measures that individuals should take against COVID-19. So what should you do? As I have explained thus far, it is important to be mindful of contact and aerosols. The basic rules are to wash your hands with water and a disinfectant, avoid touching your face more than necessary, and adhere to cough etiquette. Here is another poster from the CDC. Number 1. Prevent aerosol infections from coughs and sneezes. Number 2. Wash your hands thoroughly to minimize the virus. Number 3. Never touch your face with a hand that touched or may have touched the virus. Number 4. Use disinfectant to avoid infection from things contaminated by the virus. Number 5. If you get infected, it is important to isolate yourself in a separate room to prevent the spread of infection. In other words, you must avoid contact with other people if you develop a fever or feel unwell. That concludes my talk, but before I finish, I would like to remind you to adhere to the following measures. Number 1. Maintain social distancing and avoid close contact with others to prevent contact and aerosol transmission. Number 2. Thoroughly wash your hands. Number 3. Do not touch your eyes, nose, and mouth more than necessary. Number 4. Wear a mask and adhere to cough etiquette. And number 5. Do not go to campus when you are feeling sick.